Good morning, Jill. Thanks so much for giving me time to do this interview for the FSSI newsletter this morning.
Delighted to be here, Micaela.
So I want to start this interview by acknowledging that we're meeting, both of us, in working from home on Aboriginal lands, and pay my respects to Aboriginal ancestors, elders, past, present, and those that are emerging, and acknowledge that FSSI's work needs to keep at the forefront of our minds and at the core of our work, thinking about what we can do to improve Aboriginal people's empowerment and control over their own lives, and that is really critical in thinking about that. And in thinking about what the discussion for today's topic, which is around the Mental Health Royal Commission reform report, which was released this week. So, Jill, you've got a really interesting perspective on this. You've had an extensive career in the public service. You've been a secretary for almost 10 years in Department of Human Services and the Department of Education. You've had a significant contribution also across leadership development and education. So, Associate Dean and Vice President of ANZOG. You're on the Monash University Board. And you've had a really significant engagement with the community sector, both starting out your career, your role in working with stakeholders while you're in government, and now as the CEO of Mind, Mind Australia, a community-based mental health organisation. So I'm really keen to hear, and we'll put a link in with the newsletter, but the piece that you wrote in The Age the other day about the Mental Health Royal Commission final report. One of the quotes that really stood out for me was, we're at a pivotal moment where the will and the pathway for foundational change are in place. So from your perspective, now in a leadership role in the community sector, what are your reflections as the final report has been released?
Thanks, Micaela, and I haven't had an opportunity to fully digest the report yet. It only came out on Tuesday, so I'm sure I will think a lot more and be working on it a lot more over the weeks to come. But one of the things that really stands out is that it is one of those moments where the Royal Commission is recommending a whole of system approach to reform and change. They're not just recommending more money, they're not just recommending better services, they're recommending that all of the foundational parts of a system, everything from the legislation to the service system architecture through to the service delivery models, need to be reformed and connected. And you don't get that many opportunities where there's both will and commitment and a pathway for that kind of systems change. You often get reports that say there needs to be more investment. Sometimes you get reports that recommend major systems change, but you just don't have it. You don't have the will from government. Sometimes you don't have the will from key stakeholders. I think what the Royal Commission's managed to do is bring all of those things into alignment to at least get us to the point where there is a very good and substantial report with a lot of very specific recommendations, but still with room to fill out the detail, if you like, and a government that really, I think, wants to do it. And we have seen other examples where the work was done, but the moment got lost for different reasons.
So that point about we're at a moment in time, the next critical thing is absolutely going to be the implementation of that pathway, as you've talked about. So again, you've held significant leadership roles in implementing reform agendas. What's your thinking about what's important to be thinking about now in terms of the big work, which is now the change, the implementation change agenda, and what we need to keep in mind for that?
Yeah, so one of the things I think I said in my piece in The Age yesterday was I think service sectors are never more united than when they're lobbying government reform, and sometimes never more divided in how it should be implemented. And implementation, so first point about implementation, it's the area that certainly from a government perspective, and I tried to really not do this when I was in government, but we often think implementation is the announcement of the initiative and the money to go with it. And that is just the beginning, because implementation, I think, is a much more sophisticated and difficult and long process of technical change, adaptive change, practice change, culture change. It's all about how you move service systems on to meet the objectives that the reform is aiming for. And that takes a whole lot of work. It's nothing to do really with just the announcement of the funds and the bringing it to life. And you only have to look at the number of people who worked for many, many years to bring about an NDIS system, and then look at how many years it has taken and is taking to get that massive transformation right, so that the people it's intended for are getting what they need in a way that they need it. And we've seen enormous issues along the way with that implementation for all sorts of different reasons, but it's a great example of where the transformation you envisage is pretty hard to do on the ground. I think, go on.
I was going to say, what's the leadership task? I mean, you've held leadership roles. What do you think the leadership task is now? What are you thinking? What are you thinking about from Mines, from the CEO of Mines seat?
Well, if I just start with how I viewed it in government, I was really influenced by the work of Cotter on how you build coalitions for change, how you build coalitions of interests of the people that care about and operate and receive the services in the system that you're trying to transform, in this case, mental health, how you embrace and build a coalitions for change, because invariably people don't agree on everything. And people want the things they like and want to change the things they don't. And that's complex because everybody has a slightly different view. And while you don't want to lose the essence of the reform, you don't want to compromise for the sake of it, you also don't want to dig in and not see the potential in how to work together, what we would these days call co-design, the way this system should actually get built and operate. So that notion of building coalitions of change and working with them to really have a deep implementation approach was something that I used in government through at least 2 big major transformations that I was involved in. And from the perspective of now being one of those sectoral interests, if you like, but a pretty important part of the system, I look at it in a relatively similar way. I'm looking around at the partners and potential partners in building a new mental health system, including government and including clinical partners and including, importantly, families and carers and consumers, and thinking, how do we all roll up our sleeves and take our best ideas and help government and others implement this? Where are the opportunities to be as creative as we can be? And I think what that means is you bring your best ideas and your ambition to the table, and you also come to the table expecting you'll have to give something up because you won't get everything you want, and some ideas will be better than yours or will just prevail. So you have to be prepared to engage in true reform where we're all excited and occasionally disappointed.
So it is an incredibly exciting moment, and it is fantastic to have, as you've said, both the will and the pathway. So look forward to engaging and partnering with you, Gill, on that and seeing where things go. And hopefully, as you've just said, people bringing their best ideas forward. Thanks.
Thanks, Micaela.